I know that, one of the areas around which I feel very confident is that like I'm a technician, I use my hands, and I feel very confident about my ability to use my hands. But I often say to students, or to people when they ask, um, if they say to me, "Well, what's your favorite case? What's your favorite kind of surgery to do?" Like I'm primarily trained as a sports guy, but I do all kinds of orthopedic surgeries, and some of my favorite cases have nothing to do with sports. And the cases that I enjoy the most are the ones that frighten me the most. And the reason why, there are cases I can prepare perfectly for the case. I can do everything exactly as the way that I learned in the textbook and everything. But even still, bad shit happens. And sometimes I do something, and like, say, for example, I'm doing a hip replacement. I'm putting in the femoral component, I'm hitting it with a hammer, and I know that I can hit it so hard before the bone will break. But in this particular case, I'm working on little old granny, and her bone is a little bit softer than normal. Bang! I cracked the femur. It's like, oh shit! Ah, now what do I do? Because the component's going to be loose. I have a femur fracture on top of that, and I took something that might have been an elective case, and I've turned it into a trauma case now. And I, even though those cases are what I call sphincter puckering, okay, because they make my butthole clench up. I
Technical
enjoy.
term.
I don't enjoy those cases in the moment that
Hmm.
I'm doing them, because it's like, oh shit, how do I deal with this problem? But in hindsight, I enjoy those cases, and the reason why I enjoy those cases is because they challenge me. Right? This is not the way it looked in the textbook. How am I going to fix this thing? How am I going to figure out how to get out of this problem? I enjoy those, and I enjoy the challenge of trying to come up with a novel way to deal with this that somebody might not have thought about before. And so, reading what I read, and uh, you know, looking at the content that I do, or making the content that I do, is just part of the process of me gathering more information. There are lots of times, when I look at what I do, and like where I've taught myself skills. So, say for example, as I said, I'm a general orthopedist because I work in a community hospital, but I am trained primarily as a sports orthopedist. And I would say, like, normally when you look at sports orthopedic surgeons, they usually do one joint. So they're a shoulder guy, they're a knee guy, I'm a hip guy. I am not that. I have learned to do arthroscopy, so arthroscopic, minimally invasive surgery in all of those joints. And for some of that stuff, so for example, hip arthroscopy, I've largely trained myself. I was exposed to it for a short period of time during my fellowship, but I learned how to do that myself, trained myself how to do that. And I've trained myself to the point where I could say that I am. We just had a paper. I'm part of a group, an international group called the Define Group, and that paper was just published in the Arthroscopy Journal today. And I'm one of the authors on that paper, even though I'm not an academic guy.